As exercise principles move from the athletic realm to the medical setting, it is important for you as a future ISSA fitness educator not only to have a good working knowledge of many types of conditioning programs, but also to be able to apply them to special populations. Strength training research has grown and will continue to grow rapidly. Scientists are applying progressive resistance techniques to larger treatment groups, and they are increasing the overall body of knowledge in this area of sports medicine. The past Surgeon General estimated that close to 85% of our most dreaded diseases could be prevented with appropriate lifestyle changes, including a good diet and regular exercise. Proper healthy lifestyle behaviors and sensible exercise not only prevent disease and untimely death, but improve quality of life. Let's get started with the benefits of exercise for the senior population. Fitness activities for older adults is very important to overall health and quality of life. Dr. DeVries of USC has shown that men and women in their 70s and 80s can achieve levels of vigor associated with people 30 years younger. Older adults who want to maintain physical and emotional independence must engage in regular exercise. Most older adults fear losing independence more than they fear death, and regular exercise can help them to prolong their independence. Before beginning an exercise program, it is important for older adults to get a medical clearance from their doctors. Older adults are more likely to suffer from decreased range of motion, muscle strength and function, and elasticity of connective tissue. They may also suffer from orthopedic problems such as kyphosis and arthritis. Tests to be performed by their doctors may include blood panels, EKGs, and neurological assessments. A strength program for an older adult should be of moderate intensity with a greater number of repetitions. You can substitute any free weight exercise that is difficult to perform with a machine or partner-assisted exercise until the client reaches a good base level of strength. Strength workouts should be done 2 to 3 times per week in conjunction with a cardiovascular program. The duration of total exercise should be approximately 60 minutes, which includes 30 minutes of cardiovascular work and 30 minutes of resistance training. This, of course, is dependent on the state of fitness for each participant. Also, this duration must be acquired over time. The intensity of a senior program for a beginner should be low to moderate. This is approximately 50% to 80% of estimated VO2, or 60% to 75% of maximum heart rate. The rate of perceived exertion should be somewhat hard. It is very important to include flexibility training after each session. One of the many encouraging developments of recent years has been the realization that physical activity for the disabled can make a major contribution to quality of life. Adaptive fitness is a therapeutic and educational approach to working with the disabled. In adaptive physical fitness, APF, teaching styles and activities are modified to ensure success for each individual. The focus of APF is to increase the psychomotor skills of disabled individuals and allow them the opportunity to achieve their greatest potential. Adaptive physical fitness programs address the major components of physical and motor fitness, including agility, balance, body composition, cardiovascular endurance, flexibility, muscular endurance, muscular strength, neuromuscular coordination, power, and speed. There is virtually no chronic condition that cannot be positively influenced by proper exercise and a caring instructor. If you desire to be an effective teacher of the physically limited, you must be willing to adapt, modify, and create until your client is successful. The role of an exercise intervention for chronic conditions is to increase functional fitness without exacerbating existing conditions. While individualizing exercise programs for individuals with disabilities can be very challenging, it is critical to consult with a disabled person's doctor and therapist. Although improper programs can be harmful, sensible workout routines in the right environment can greatly benefit your disabled client. For example, clients with obesity, back pain, or ambulatory limitations can find success in an aquatic training environment. The goal of an adaptive fitness session for a client with a disability is physical activity that will lead to improved fitness, mobility, and self-efficacy. The United States and other nations are faced with a growing obesity epidemic that extends to youth. Children's physical education programs are extremely important in addressing today's problems with obesity and poor nutrition. But schools are often underfunded, and programs are often administered by teachers with little to no sports or fitness expertise. Children with disabilities and children wishing to participate in sports can benefit a great deal from working with a trainer as well. The task at hand is to promote fitness, make it appealing to kids at different age levels, and help children to maintain active lifestyles beyond their youth. It is important to keep in mind that children are not miniature adults. You cannot use the same training methods or motivational techniques on growing children as you do with mature adults. Children are different from adults anatomically, physiologically, and emotionally. And different age groups have different safety considerations and guidelines. General guidelines for training children all include a warm-up before beginning resistance training. Multiple joint exercises can be used, but the focus should be on form and technique rather than the amount of weight lifted. Begin with light loads to allow for appropriate adjustments to be made. Increase loads gradually, 5 to 10%, as strength improves. Workouts for children should not occur in succession, but allow 1 to 2 full days between workouts, and 2 to 3 non-consecutive workouts are recommended. Finally, encourage kids to drink plenty of water before, during, and after exercise. Teaching children the principles and benefits of resistance training to overall fitness will be important in maintaining their health. We will now move on to some health topics that can be dangerous and debilitating for individuals, but that can be improved with a proper exercise program and attention to nutrition. The first topic we will discuss is hypertension, or high blood pressure. Statistics indicate that an estimated 60 million Americans suffer from a chronically elevated level of arterial blood pressure, a medical condition known as hypertension. In the vast majority of instances, high blood pressure has no identifiable specific cause. Hypertension adds to the workload of your heart and arteries, and it is a primary risk factor for coronary heart disease. Coronary heart disease is the leading cause of adult deaths in the United States. Considerable research suggests that the following steps can be effective in the prevention and treatment of high blood pressure. Maintain a desirable body weight. Limit alcohol intake to no more than 1 drink for women and 2 drinks for men per day. Do not smoke, as nicotine has been shown to constrict the small blood vessels and raise blood pressure. Moderate the amount of salt in the diet. Consume adequate amounts of calcium, magnesium, and potassium. And lastly, exercise on a regular basis. While drug therapy is traditionally considered to be the most effective form of treating high blood pressure, regular exercise has been found to be a valuable and safe adjunct therapy for many hypertensive individuals. Keep safety in mind when designing a fitness program for a hypertensive client. Emphasize non-weight-bearing or low-impact aerobic activities such as walking, stair climbing, cycling, and swimming. Exercise intensity should be kept at the low end of the intensity range, which would correlate to approximately 40% to 65% of VO2 max, or 55% to 85% of MHR. The recommended rate of perceived exertion range for these individuals would be 10 to 13, light to somewhat hard. Exercise duration should begin at 20 to 30 minutes of activity per session and progress to 30 to 60 minutes as adaptation occurs. Hypertensive individuals should be encouraged to exercise at least 4 times per week, although exercising on a daily basis is preferable. A prolonged warm-up period, greater than 5 minutes, is advised to ensure that the hypertensive individual's cardiovascular system is prepared for the upcoming physical activity. An extended cool-down period, greater than 5 minutes, is recommended so that a gradual transition can be made from the conditioning activity back to the resting state. More than 150,000 Americans die annually from diabetes and its complications. Diabetes has also been shown to increase the likelihood of suffering from heart disease, stroke, gangrene, kidney disease, and a serious eye disorder called retinopathy. Regular exercise has been shown to be an effective means to help control diabetes, Any exercise program for a diabetic should be designed in accordance with the type of diabetes and its severity. Exercise can have a significant effect, not only in helping diabetics control their disease and reducing risks of its life-threatening complications, but also in prevention of diabetes in the first place. Benefits of exercise for diabetics include 1. Lowering excess blood sugar by helping transport glucose out of the bloodstream and into the cells where it can be used. 2. Strengthening the muscles and the heart, which improves circulation and therefore increases blood flow to the body's organs. And 3. Reducing stress. Diabetic individuals should undergo complete medical evaluations before starting an exercise program. They should also be encouraged to monitor their blood sugar levels before, during, and after exercise. Unless limited by complications of the disease, diabetics can engage in the same types of activities as non-diabetics. The intensity of exercise for diabetics should be very similar to what is prescribed for healthy adults, which is 55% to 85% of max heart rate. Strength training at a low to moderate intensity level can be incorporated into the total fitness program for diabetics. This corresponds to a repetition range of 12 to 20 per set. Although regular exercise can certainly be sound medicine for diabetic sufferers, a moderate step-by-step exercise program is needed to progress safely. In addition, there are a few actions that are important for the safety of your diabetic clients. Diabetics should be instructed to always carry a form of fast-acting carbohydrate. For example, juice, soft drinks, candy, glucose tablets, etc., in case of a hypoglycemic emergency. If exercising without you, diabetics should be encouraged to exercise with a partner who is aware of the signs, symptoms, and treatment of hypoglycemia. Diabetics should be instructed to check their feet carefully before and after exercise for swelling, because of their increased susceptibility to infection. We will now move on to a discussion of arthritis, which, in general terms, refers to a disease that causes pain or stiffness in skeletal joints. The Arthritis Foundation states that arthritis has a cost that goes beyond pain. Medical care, lost wages, insurance, lost income taxes, home care services, and more. Conservative estimates of the annual cost of arthritis place the total at approximately $15 billion per year and rising. Exercise can help individuals who suffer from arthritis. Numerous studies have been conducted in the last decade showing that properly performed exercise can have several benefits for arthritis sufferers. Most importantly, activity helps prevent joints from stiffening up, which can turn everyday activities into exhausting and painful chores. Exercise can improve the physical body, as well as the emotional outlook of arthritis sufferers. Moderate to severe cases of arthritis can all be improved with exercise. The Arthritis Foundation offers 6 basic guidelines for helping individuals with arthritis exercise safely and effectively. Consult with a physician to develop an appropriate exercise program. Begin the exercise program at a safe and comfortable intensity level, and gradually increase it as the body responds to new demands. Allow sufficient rest between exercise bouts. Rest as much as needed. Exercise at least twice a day. Develop a structured plan for exercising daily, that is, time and place, and stick with it as much as possible. All other factors being equal, exercise during a time when the individual has the least amount of pain, stiffness, and fatigue. Arthritis sufferers should include 3 basic types of exercise in their workouts. Flexibility exercises utilize the full range of motion of our joints. This increases the manufacture of synovial fluid, which lubricates the joint space. It also helps move lymph fluid, which reduces overall swelling and helps deliver oxygen and nutrients to the joint tissues. This facilitates healing. Many arthritis sufferers have strength deficits, which make everyday activities difficult. Strength training exercises help increase muscular fitness and improve an individual's functional capacity. Aerobic training helps to increase overall endurance and combat fatigue. Recent evidence indicates that proper exercise can help reduce the likelihood of developing arthritis. Heart disease is the leading cause of death in the United States. Contrary to the misconception that heart disease is an inevitable consequence of aging, research has shown that lifestyle, too much saturated fat, too much sodium, too much alcohol, smoking, too much body fat, and not enough exercise are the predominant contributing factors to heart disease. The most serious form of heart disease is coronary heart disease, or CHD. CHD essentially involves the obstruction of the blood supply to the heart through the 3 coronary arteries. Nearly 1/3 of all of the non-accidental deaths that occur in the United States each year are the result of CHD. Of the known modifiable risk factors for CHD in the United States, cigarette smoking is perhaps the most important. More than 10 million Americans suffer from some degree of debilitating and chronic disease caused by smoking. The number of deaths annually in the United States that can be directly attributed to smoking exceeds 350,000. Another risk factor is age. Men over the age of 45 and women over the age of 55 are at higher risk for CHD. Family history is another risk factor. If your father or other first-degree male relative suffered a myocardial infarction or sudden death before age 55, you are at greater risk. You have the same risk if your mother or other first-degree female relative dies of the same causes before age 65. If your blood pressure, confirmed by measurements on at least 2 separate occasions, is 140/90 or higher, or you are on antihypertensive medication, your risk goes up as well. Other risk factors include high cholesterol, diabetes mellitus, and a sedentary lifestyle. The benefits of exercise for clients with CHD include 1. Reduced blood pressure due to suppression of the sympathetic nervous system, which normalizes kidney function. 2. Decreased insulin secretion. 3. Altered sensitivity of blood vessel receptors. 4. Reduction in bad cholesterol and an increase in good cholesterol. 5. Reduction in obesity. And 6. Helps in the pursuit to stop smoking. Sensible exercise can be a safe and productive undertaking for both a pregnant woman and her baby. A growing body of evidence supports the belief that a pregnant woman can benefit in numerous ways from sound exercise. Exercise can 1. Reduce the severity and frequency of back pain. 2. Enhance prenatal weight management efforts. 3. Help counteract stress or anxiety. 4. Improve digestion and reduce constipation. 5. Help provide an enhanced level of energy. And 6. Help reduce postpartum belly. An exercise program must not under any circumstance subject either the expectant mother or her baby to undue risk of injury or harm. Adhering to a few basic guidelines will keep the focus where it belongs: the safety of a pregnant woman who wants to exercise. First, stay adequately hydrated. Keep the intensity level of the exercise at a moderate level. Avoid overheating by wearing clothing that allows for evaporation. Also, be acutely sensitive to the environmental conditions that exist at the time of the exercise session. Ambient temperature and relative humidity levels are very important, since overheating can be dangerous to mother and fetus. Keep the duration of the exercise session to 30 minutes or less to avoid impairing blood flow to her uterus. Avoid prolonged bouts of exercise in the supine or back-lying position. Keep these exercises under 5 minutes. Avoid overstretching while exercising or performing exercises in a jerky or bouncing fashion. Eat a nutritionally sound diet with enough complex carbohydrates before exercise to ensure that adequate levels of glucose are available. Asthma sufferers have numerous treatment options available. As a general rule, the primary method for controlling asthma involves prescription drugs, both inhaled and oral. It is important to follow important safety guidelines to ensure that your client's exercise program is both productive and safe. Selecting appropriate exercises is very important. Swimming is a good exercise because it raises the heart rate, increases respiratory rate, and is relatively easy on the lungs. Avoid asthma triggers as much as possible. For example, if your client is allergic to pollen, exercise indoors. Avoid outdoor exercise on high pollution, cold, and dry days. Encourage your client to wear a mask or a scarf to warm and moisten inhaled air if he or she must exercise outside on a cold day. If possible, exercise in warm, humid air. Perform specific breathing exercises to strengthen the lungs. Have your client medicate 30 minutes before engaging in an activity or exercise, and have him or her keep an inhaler close by during exercise. Perform controlled warm-up exercises prior to working out, and avoid very intense exercises for prolonged periods of time. Advise your client to breathe through the nose as much as possible while exercising, and control breathing rate to prevent hyperventilation. Although no ISSA trainer should ever diagnose a disease or attempt to treat diseases in a medical fashion, this would be unethical as well as illegal. It is imperative for all future ISSA trainers to have a working knowledge of common medical conditions that afflict clients today. Work with a client's physician and other allied health professionals to produce a program that best benefits your client's condition.